topic was amazed. I was amazed when the topic was presented to us because we at IT Company, we've been doing this over a decade, supporting our clients through remote desktop and over the phone. And I always amazed why medicine providing a service to patients, why can't it be that way? So I'm very excited to learn more about it, what's going on, and when we will be able to start telemedicine in the state of Florida. A little bit about the webinar. Every attendees are on a listen-only mode right now, but throughout the webinars, you can submit us a question where once the presentation is done, we will be going through each question. We have Jordan here who's going to be helping us with all your questions at the end. So not to delay anymore, let me have Sarah start. So thank you, Sarah.
Thank you so much. And thank you, everybody. My name is Sarah, and we appreciate your time today as well for joining us over your lunch hour. And also we wanted to briefly thank Soren Patel and Computech City for having us speak to you today. It's an interesting topic. We appreciate your time.
Thank you.
So I'm going to go ahead and begin. We're generally trying to provide you a telemedicine update. And we have several topics up here on your PowerPoint. We're going to speak generally over what the terms of telehealth and telemedicine are. We're going to speak to the current regulations and laws in Florida. And also we're going to discuss some of the proposed legislative bills currently being considered by our Florida legislature. And my colleague Darren is going to speak on some of the legal issues in telemedicine. And we'll conclude by speaking on future trends that we're seeing in telemedicine and where it may be going in the future. So the first topic is the terms. So I'm sure many of you have heard through articles, media, reading literature, the terms telehealth and telemedicine. They're used a lot in this context. And sometimes, what does it mean?
I always thought it's the same thing.
Well, they're exactly. And interestingly, the terms vary state by state and the federal government. And with that, many states do actually have statutes on the books that define them. Many do not. Florida is one of those. We'll discuss that shortly. And the federal government, even to confuse things, they use the word telehealth. For example, as the Centers for Medicare and Medicaid Services do. And the Florida regulations, which are not statutes, with Florida we have the Florida Constitution, we have Florida statutes, and then we have Florida regulations. Florida regulations do actually define the term telemedicine. So it provides guidance, but it's not a statutory law yet in our state. And then there's a national organization, the American Telemedicine Association, and they interestingly use telehealth and the telemedicine terms interchangeably as synonyms. And then if you're so lucky, you might get a little bit more confused because sometimes you hear the interstate practice of medicine, remote medicine, and these words are used interchangeably. So it keeps the topic interesting. So we're going to try to provide a little bit of clarity for you today. Telehealth generally is a broader scope of remote healthcare services, and it includes both the clinical and the non-clinical services. So you have the actual healthcare providers providing services to patients, and the non-clinical side. So it's a very broad spectrum. Even using technological devices for training or meetings or consulting, for perhaps they're unrelated to the actual patient care. Whereas telemedicine becomes a subset of telehealth. So telehealth is our umbrella, and then we have telemedicine underneath that. And telemedicine is the actual provision of healthcare services to patients. And I won't read this definition verbatim, but this is the federal definition under the Centers for Medicare and Medicaid Services. And essentially, again, this is a definition of telehealth, as they use the term, but it allows for two-way, real-time interactive communication between a patient and a distant site physician. So think of it, two people sitting at computers, FaceTime, Skyping, and you can see your face, and that's what this is really referring to. Now, as I mentioned, that Florida has a regulation that defines it, and it uses the term telemedicine. It is the practice of medicine that allows Florida licensed physicians, and that would be a doctor of osteopathy and a medical doctor, or a physician assistant. So it's limited to those two types of healthcare providers right now under this particular definition. That allows for medical information to be exchanged from one site to another via electronic communications. So like I said, the Florida statutes do not define telemedicine, and that segues us into this next topic I want to discuss. The Florida legislature has actually been trying to adopt laws in the state of Florida for some time. But briefly, I will touch on the regulations that are currently in place. These rules, and again, they provide guidance, but they became effective approximately a year ago. Today's March 13th, and March 14th last year, these regulations were implemented with some slight amendments, but nothing too substantive in those amendments. So there's been movement we've seen for rules being implemented, but no statutory provisions yet. But what I want to do briefly is just go over what the Florida regulations do cover, and there's certain key provisions that they do discuss. And interestingly, the standard of care, whether you're providing inpatient care in a physician office or a hospital setting when it's face-to-face, the same level of care is required for that in-person doctor-patient relationship as the telemedicine relationship that's through electronic means. And that level of care is the skill and treatment recognized in general law. And what that means really is the prevailing professional standard of care that is recognized as acceptable and appropriate by reasonably prudent similar healthcare providers. So that's the legalese term of art that courts of law use if and when there's ever a liability or a lawsuit. But that's the standard of care that physicians must provide, or other types of healthcare providers. So the standard of care is going to be the same whether you're providing telemedicine through remote means or in person. And this first topic, or first bullet on this slide, is actually a very interesting point. The Florida Board of Medicine, in the past, as of even three years ago, if I recall correctly, they required that a patient and a physician had to engage in a face-to-face encounter prior to engaging telemedicine. So your first encounter with a patient could not be via electronic means. So you actually had to go to the doctor's office or meet them in the hospital setting or somewhere. Thereafter, you could then engage in remote medical care by electronic means. But interestingly, what this new regulation did last year was it eliminated this requirement. The Florida Board of Medicine, via these rules or regulations, has now allowed a physician-patient relationship to be established through telemedicine, and that's huge. And that's what a lot of the national view or supporters of telemedicine would like to see, because if you do require that face-to-face encounter, it seems to hinder and restrict access to these technological advances that telemedicine can provide. Because if I have a cold, it may be much more efficient, and it really is efficient, and cost-wise is cheaper as well, to be able to engage remotely with a physician versus going to that doctor's office, or if you have a bloody nose and you're going to the ER. I mean, think about it. So eliminating that face-to-face encounter requirement is huge, and that's the step in the right direction for Florida to really advance its implementation of telemedicine. The second bullet here is physicians licensed in states outside of Florida cannot practice telemedicine in the state. And I touch on this too. This is a buzz provision, or an issue, I guess you could say, nationally, because a lot of supporters of telemedicine, including the American Telemedicine Association, a national organization, they often would like to see physicians licensed in Georgia or California or other states be able to remotely provide telemedicine services in our state.
Right.
Because again, for the efficiency, the technological advancements, reducing costs for patients to have more access. However, on the flip side, states like Florida are taking the position, well, we really want you to be licensed in our state, go through our licensure process and examination, and it also touches on liability issues. Because if you have a physician outside of our state remotely providing services, would they be subject to jurisdiction in our courts if there's a liability? So you have to think about those things. So that's where Florida is right now in its position. And also, controlled substances cannot be prescribed through telemedicine And that's a big one. The way the Florida Board of Medicine is viewing this today is they want the patient to be in a hospital, and if a patient is in a hospital, then you can remotely prescribe controlled substances, but then the patient's in a controlled environment under the more direct supervision of healthcare providers generally. To continue, consultations between physicians and review of digital images, etc. you can read, are permissible, and that's key because a lot of physicians do consultations of images, x-rays or whatnot, or if they're wanting to discuss something with another physician, that's permitted, and a consultation is really even permitted with a physician outside of our state, so long as it's physician to physician. So that is something that physicians can engage in. So treatment recommendations, including prescriptions or issuing prescriptions via the electronic means, can be made under Florida regulations under these conditions. You have to document the patient evaluation, including history, physical examination, and there must be discussion during that electronic communication about the prescription drug being prescribed, discussion of treatment options, and the physician, even though they're doing this remotely via electronic means, I say physician, but in certain contexts it could be a different type of provider, but there must be maintenance of patient medical records as required by Florida rules and Florida law, because there are requirements on that. And then Florida's telemedicine regulations do not currently apply to emergency medical services. So if there's a critical illness or injury or emergency medical care, they don't apply. They don't govern. So this is always interesting. Like I said, Florida is trying and has been trying to implement some legislative bills. So I'll begin briefly with 2014. Everybody was under the impression that we would see some laws in 2014 come through, but unfortunately the legislature, meaning the Senate and House of Representatives, were unable to find agreement, and the proposed bills failed. But for example, what the proposed House bill did last year was provided practice standards for the telehealth, and I use telehealth when I really also mean telemedicine for purposes of Florida, since we do use that term commonly here. It allowed physicians licensed in other states to register with the state prior to offering telehealth services to patients. So registering and becoming licensed in our state are two distinguishing factors. So this law was heavily favored by a lot of the telemedicine supporters who wanted to see more flexible standards, so to speak. So a physician would have, and again, it never got to passage, so we don't quite know what the registration requirements would have been, but it would have been a way for a physician outside of the state to come in and say, I'm qualified, I can do business in my state as a physician, and I'm sure if you met some stringent requirements for the state of Florida, you could somehow go through a registration process where you would be able to engage in the telemedicine. And obviously, like I kind of touched on, supporters believe that type of law would have greatly expanded access to telemedicine for patients and given them more choice in how they receive their medical care. So in the 2014 proposed Senate bill, interestingly, out-of-state physicians were required to obtain a Florida license. So they took a more stringent view, and I think that's where a lot of the tension or disagreement, so to speak, arose between the House and Senate last year, and one of the primary reasons that the law did not fail because the law did fail. So again, like supporters of telemedicine believe the Senate version was too restrictive, it would have slowed advancement, and so again, we unfortunately did not see anything pass last year. So that brings us to 2015. The legislative session in Florida began on March 3rd. And I believe it goes through May, if I'm not mistaken. I don't know the exact date it ends. But anyway, we have two bills. So again, one in the Senate and one in the House. The House Bill 545 was actually discussed yesterday. So we could be seeing more on that coming out in the next few days to see if any amendments took place, what the points of contention were among the committee members who were discussing the bill. But we're generally seeing that the legislators are saying, at least to this point, that they are very confident they will in fact pass a law this year to catch up with other states, get something on the books and the statutes that really helps providers in telemedicine move forward with that practice.
23 states already have it?
Yeah, it's approximately 23, yes, that currently do have it. And again, it varies state by state, like I started this presentation with. It could be telehealth terms, telemedicine. And certain other issues we're seeing is some states that do have laws on the books, they're mandating that private insurance companies actually cover the services of telemedicine. Some states do not. So some private insurance companies are not. It's self-pay or out of pocket for a patient. Which is, again, like Darren's going to touch on this, but some of the reimbursement issues, but that's another hot topic in telemedicine right now, is if I'm a patient, how will my services be paid? Will it be covered by Medicare? Will it be covered by Medicaid? And some states have Medicaid requirement coverages, and then some do not. And then will private insurance companies also pay to cover it for patients? So, and that's many reasons why people want to see it in the statute, so we can cover some of those issues. And like that touched on my very last bullet here on the slide, whether the telehealth services will be covered by Medicaid. The current House bill that was discussed yesterday, it currently does not allow for Medicaid coverage in its text as written right now, but the Senate bill does. So there are some variations, but again, they're saying they'll find some agreement. I think the hope is that the Senate bill will move forward in the sense that it does allow for Medicaid coverage for telemedicine in the state of Florida. But interestingly, neither one of those bills mention private insurance. So whether you have United Healthcare, Blue Cross Blue Shield, whatever your employer may offer to you or you offer to employees, may or may not be required to cover telemedicine services. So at this point, I'm going to turn over the discussion to my colleague Darren, and he'll discuss the legal issues in telemedicine.
Thank you. Good afternoon. It's a pleasure to be here with you. We are now going to move into some interesting topics that would be very important to you if telemedicine does make its way into Florida. The first one we'll be looking at is reimbursement. No matter what we do, we always have to keep in mind for reimbursement. That is how, as our revenue stream, that's how we get paid. So reimbursement is certainly something that's always top in our minds. So let's start with insurance coverage. Insurance coverage is a current impediment to telemedicine, one of the serious obstacles to the expansion of telehealth. One reason is because it hasn't been covered in Florida. Florida has no law, as Sarah just mentioned, so this is going to be a major issue. Medicare, which of course is the federal payer, has to some extent set a standard and does reimburse for telehealth services, but only when the originating site, which is where the patient is located, is a health professional shortage area, or a HPSA, or in a county that is outside of any metropolitan statistical area, or an MSA, as defined by the Health Resources and Services Administration and the Census Bureau, respectively. So there is a little bit of a coverage area under Medicare, but only in a limited application. So reimbursement is going to be an issue no matter whether Florida adopts a rule or not. Currently, Medicaid reimbursement varies from state to state. As you know, Medicaid is a combination of state and federal application rules, so each state is going to treat this differently. 22 states have enacted laws that recognize or require reimbursement. Approximately 45 states have some type of reimbursement policy for telehealth services. As we mentioned several times this afternoon, Florida has not yet enacted any law requiring reimbursement. Florida's Medicaid program, though, does have a reimbursement component, but it provides for individuals enrolled in the children's medical services in select rural Florida counties. So that's a very narrow component. Studies are currently underway to expand that coverage. There is no single widely accepted standard for reimbursement for private commercial insurance. And Sarah mentioned this a few moments ago. Some insurance companies do value the benefits of telemedicine and will reimburse a wide variety of services, but not all of them do. Mm-hmm. And certainly in Florida, where we don't have a rule yet, that's kind of hit and miss. And actually at this point, probably entirely missed because there's no rules on that. They're not going to cover that here in Florida just yet. Other insurance companies have yet to develop comprehensive reimbursement policies, and coverage may or may not exist. So even if any of our listeners travel to a state that does have a telemedicine policy, doesn't necessarily mean the private insurers will cover that.
And I will say, if I can interrupt Aaron just briefly, touch on this insurance topic. Employers, an interesting aspect to this is employers really do want to see private insurance companies cover these telemedicine services because it helps their costs as an employer.
It
to
would
reduce
help a
costs
lot.
for employees.
Actually, we have an insurance policy here with all the staff, and I know probably 80% of them didn't do their annual check. Because once it goes to telemedicine, I'm sure there'll be a doctor on the wheel. Who knows? And then we can get them here and get everybody's physical checkup done every single year so they remain healthy.
So you want healthy employees,
Exactly.
exactly. So employers really would like to see implementation.
That's a good term, doctors on wheel. Don't make still available.
Absolutely, and I think the insurers would have an incentive to reimburse for telehealth and telemedicine for all the reasons just stated. It would bring the cost down if they could treat more people in more remote locations without having them incur some of the expenses they currently have to incur. So the insurers probably would have an incentive to do this once the state clears the way. I think that's probably the hurdle.
And another thought that just came to my mind too that makes Florida unique somewhat from other states is we do have a significant population of the elderly, and baby boomers are only aging as well. So, and we have other people located in rural areas where access to medicine is a little bit more difficult, and elderly can't drive or they're not as mobile as some other people. So again, increasing access to telemedicine would really help. So that's just another thought as we move forward.
This could also be good. I know a number of our listeners are physicians, and they may be wondering, what will this do for my practice? Would this be good? Would this not be good? This could be good for physician practices as well, because they could see more patients in remote locations that may not be seeking care at all right now because they can't, it's not convenient, they may not fit in with their schedule as well, and these patients may be patients that have insurance or abilities to pay but just don't find the time to make the time to go see a physician, but would do it if they could have it done in their office through some sort of a web seminar like we're doing right now, where they could come to a telehealth locale, or maybe one would be close by, and that could be done in a more convenient way. So that could be good for the provider population too. Fraud and abuse. This is always a fun topic, especially over lunch. Telemedicine services often involve business arrangements between healthcare providers and can trigger application of the fraud and abuse laws, including a kickback statute and the Stark law. Now, I know most of our listeners probably know what these laws are. A quick one-sentence reminder about the anti-kickback statute is that it makes it a criminal offense to knowingly offer, pay, solicit, or receive any remuneration to induce referrals of items or services reimbursable by a federal healthcare program. And that has been extended to state programs and most any program, generally speaking. So how would that play out, actually? And it plays out the same for the Stark, so we'll hit that one too and then go back and give an example. Stark law prohibits physicians from referring Medicare patients for designated healthcare services to an entity with which the physician has a financial relationship. So how would that actually play out as an example? An example might be that either a hospital provides physicians' offices with telehealth equipment, which can be expensive, or maybe a physician office might provide a clinic with expensive telehealth equipment. And so that equipment might drive referrals back to either the hospital or physician office, whichever one provided the equipment. That's how that application might play out. If you're wondering, how does that apply to me, that's how that might apply to you, and that's where the issue may come. So what would we do about that, assuming that Florida does go ahead and pass a law on this and makes this happen? How are we going to get around that problem and make this work without running into a regulatory issue? And there's a couple possibilities. Under both the anti-kickback and the Stark law, we have a number of, for Stark it's called exceptions, and for anti-kickback it's called safe harbors. But some of them mirror each other or track one another. One is a space rental, one is an equipment rental. So if those two are implemented for the actual equipment in a proper way, that would work possibly. And both of those also, Stark and anti-kickback, have provision for what's called an electronic health records item or service. That's an exception under Stark. It's also a safe harbor under the anti-kickback statute. So it's designed primarily for electronic health records and that kind of thing with HIPAA to implement that. Not so much for this, but perhaps that would be an avenue by which we could implement telehealth and telemedicine. So once Florida does pass such a rule and a law and then regulations follow, perhaps we could use those exceptions to implement telehealth and telemedicine so you all have access and benefit of that for your practices without running afoul of Stark or anti-kickback. There was an advisory opinion adopted back in 2011. It was August 29, 2011, and it had to do with the Neuro-Emergency Telemedicine Program. This is a very specific program. The program was approved, and the reason it was approved was there were sufficient safeguards, the federal government believed, to prevent any kind of anti-kickback likelihood. And in that case, the federal government believed that the public benefit of promoting a timely access to specialty care for acute stroke patients outweighed any risk to the federal healthcare program. So OIG opinions can be obtained. There usually is a rather expensive way to go. In this case, though, there's an example of one where they felt that would work out just fine. Usually we recommend trying to stick with some sort of a safe harbor for the anti-kickback statute or an exception for the Stark law. And that's what you wanted to know about fraud and abuse during the Patient privacy. This one's kind of an obvious one. Telemedicine, working over the internet or the phone lines, and how do you make that secure? You have something you're very familiar with, and Computex City is very familiar with. So that's not new territory here. But one thing that, just for your education benefit, telemedicine providers and entrepreneurs are developing new interfaces with technology to allow virtual physician-patient encounters. Providers, as you well know, must ensure patient-protected health information is secured by communication channels and implement all appropriate business associate agreements and confidentiality and privacy agreements. Something you're very familiar with, something you're already doing in your practices each day. Patient privacy must be protected and must be compliant with HIPAA and with the HITECH Act. Just a reminder, something you're already doing. Medical malpractice. As Sarah already mentioned a little bit ago, this is an interesting area because of the lack of actual physical contact between the patient and the physician. The breach of duty owed by a physician rendering professional services to a patient, medical professionals are required to maintain professional liability insurance, as Sarah mentioned a little earlier. Most medical malpractice insurance covers face-to-face encounters, and the patient must be in the state where the physician is licensed. So if telemedicine and telehealth rules are passed in Florida, what will that do? Will those rules address these issues? We hope so. We don't know for sure. We'll have to watch that and see what happens. But that's something that you all as providers will want to be sure you're conscious of and cognizant of. So these issues raise coverage issues for physicians who provide telemedicine services to patients who may not have a face-to-face meeting initially, an encounter with patients and patients who are outside of the state in which they are licensed. Therefore, it's very important that you would check with your medical malpractice liability insurer prior to providing telemedicine services once the law in Florida is passed, and that you are very aware of what the provisions in any Florida law that would pass once it is passed, so that we're sure that those rules are being followed. And that takes me to the end of that section and back to Sarah.
Okay, thank you, Darren. Yes, so we've covered quite a bit, and we'll, I think, nearing our conclusion. So just briefly, what we wanted to do is kind of discuss some of the future trends we're seeing in telemedicine and talk about some of the statistics and whatnot. So what we're seeing really is that the number of patients using telehealth is projected to be 7 million in 2018. I mean, that's just a huge number. So that's just in a few I'm sorry, I'm losing my words here. 3 years from now. There we go, I got it out. So anyway, so we'll see that soon. I mean, that's huge, and it's expected only to increase. And a lot of us today are very comfortable with FaceTime. We have a lot of these Apple products, whether it's your iPad, iPhone, or whatnot. But individuals who currently use Skype and FaceTime, which is the vast majority. I mean, my mother even knows how to use it today. I mean, that's where we're going. But those types of individuals are more inclined to use these telemedicine services, and they like it because I don't have to leave my house, or I don't have to leave where I'm located to engage in medical care for myself, whether it's my child who just skinned their knee or has a sore throat, or these types of conditions. So, and again, this touches on this, on-call physicians and ER physicians can provide treatment via these electronic means, and it greatly reduces, again, we've kind of touched on different topics, the costs, time. So it's a great asset for treating conditions like the sore throats and the earaches and the skin rashes. I mean, it's just amazing how clear your picture can be, by holding up an arm or, some type of injury on your leg or your toe, think about, ingrown toes or nails, all of this stuff. And an interesting thing we've been seeing is patients who are en route in ambulance services on the way to a hospital, physicians can provide ambulatory medical consultations en route. So when that patient arrives on site at that hospital, the physician on site at the hospital is already in the know. They've preliminarily diagnosed and treated and understanding what the physical health and condition of that patient is, whether emergency or minor or whatnot. So again, these are all these great benefits that you as providers will see in the future. So again, I mean, we're seeing lobbying efforts right now, and the legislature is considering those two laws, the House and the Senate version, and I'm sure we'll see some amendments and tweaking and some hopeful final language that is in fact passed before close of the session this May. And of course, in advocates, we've touched on these topics, insurance, Medicaid coverage. I mean, they hope to see mandatory reimbursement provisions, because I was a participant in a telemedicine conference earlier in 2014, and again, I mean, you couldn't hear enough of the word reimbursement. I mean, that was just such a hot topic. I mean, reimbursement, and out-of-state providers coming in to provide telemedicine services in states, which remains to be seen in Florida as well. So, and according to the Florida Tax Watch, it's a business research institute, Florida could save more than $1 billion annually if telehealth services are available to reduce the costs from emergency room stays, hospital visits, and transportation by just 1%. I mean, that is huge. So that's where we're going. That's what we'd like to see in the promotion of telehealth, telemedicine. So that does conclude our summary that we prepared, our presentation, and I guess this time we'll take some questions.
Yes, thank you, Sarah and Darren.
Pleasure.
Jordan, do we have any questions? Guys, we're going to be here and sticking around until we answer all of your questions. Again, if you missed me in the beginning, you can type your questions in your GoToWebinar on the bottom. It says chat. So you can type it. Jordan will immediately receive it, and we're going to go one by one and answer them for you. So Jordan, do we have any questions?
So far, the only question is, please slides be available.
Yes, we are recording So we are recording this webinar, and it was very soon. Give us a couple of weeks, and we will have it on our website, and all the people who have registered and be invited, we will send you guys a link to this webinar. So in case if you missed half of it or you missed 100% of it, you will be able to go back and listen to and watch it at your convenient time.
Are there any particular websites that you recommend to get information?
Sure. I mentioned the American Telemedicine Association. That's a great resource for learning about general topics, and that can also provide guidance, on what other states may be doing, covers, periodicals and articles written on these subjects. So that's a great resource. And I did mention that Florida Tax Watch, you may want to also consider visiting their website, because they did have a statewide seminar in the fall of 2014. It was kind of in preparation of the upcoming legislative session to discuss a lot of the topics that they'd also like to see passed with new legislation. So those are two that come to mind immediately. They could provide insight on this topic for you.
Right, and as you guys know, they are from Gary Robertson, so they have a team of people who are doing this research and keeping up with all the regulations and what's coming up. So at any point, if you guys are interested in opening something or want to keep track of it, that's your future business plan, of course, please contact them, and they'll be more than happy to provide their service to you and help you go to the next level.
Right. Yeah, to that end, when the PowerPoint is made available, our contact information is on slide 1 that provides both of our email addresses and our address, and you can easily go to our website too as well and find us and phone numbers and contact information.
Yeah, it's a Gray
Gray.
I mean Gray.
Yeah, it's okay, Gray.
I'm sorry.
That's
Gray.
okay, that's okay.
Gray-robertson.com. That's their website address, and of course you'll find more. But just in case if you guys miss anything, you can always contact us, and we will get you guys in contact with them. So, any more questions?
We have one more question. Are there any forums that have wants to express their opinion on the subject where allowed to do so? Forums? Just anywhere that would express their views. That's a great question.
I would probably say that myflorida.gov is the Florida website, and from there everything's on there, from tracking legislative developments to business forms to everything. So if you want to go to myflorida.gov, you can go to the legislative portion of that website and then drill down to bill tracking and that kind of thing, and I would imagine that's probably the best place to go for something like that.
Are they taking the residents' opinion and voice, or do you guys know if that's the main question?
Well, you may want to go through that to locate your particular senator and House of Representatives.
That's what I was going to mention.
And go that direction, because that person will be more likely to get your opinion heard rather than just registering a comment on the internet, which I would suggest may not be the most effective, but going through your own senator and House of Representatives representative person for your district would probably be the best route.
Right, they have aides that, I mean, the legislatures themselves may be very busy, but nonetheless, you'll have access to one of their aides if you don't get the legislature. And this is a great and critical time if you have views or opinions or comments about what you'd like to have or for insight, since they're in session right now and considering these two bills. So Darren nailed it on the head. That's a great way to reach out and get your opinions.
And especially since you are providers, I think that your comments would carry a lot of weight with your representatives.
Us as a patient. Perfect. We don't see any more questions, so thank you very much, guys, for your time this afternoon. And looking forward to the next webinar, which is coming soon, is scheduled. So far, we have to put it on our website, and it's going to be HIPAA and risk assessment, what it is, why it is, who needs it, when you need it, and how to get it done. So it's our in-house webinar, so it's going to be covered by us, all the experts at Computex City. So please stay tuned, and thank you very much, guys, and you have a good weekend.